Welcome to our channel, Dr. Vet. Come to the livestock world. Paratyphoid in quail salmonellosis is an infectious disease caused by Sallmonella bacteria. Quail of all ages are susceptible to the disease. This is also a disease that farmers often face. In this broadcast, join us to learn about how to prevent and treat salmonellosis in quails. Salmonellosis is caused by Salmonellosis bacteria. After entering the body, bacteria grow in the digestive system, creating damage to the intestinal mucosa, causing enteritis and bleeding. In severe cases, bacteria enter the bloodstream, causing septicemia. Quail can get salmonellosis at any age, but the disease is often severe and death occurs in young birds under 1 year old. At a high rate 50 to 60%, the disease can occur all year round, but it mainly appears in the spring, early summer, and late fall months when the weather is warm and humid. Quails are infected with salmonellosis through the digestive tract by eating or drinking food containing bacteria, leading to salmonellosis infection. Bacteria reside and grow in the intestinal mucosa and intestinal lymph nodes and secrete toxins. The toxin dissolves in water, affecting the central nervous system. Sick quail eggs have blood on them. The eggs are sharp and soft. For young quails, there is a phenomenon of drowsiness, drooping eyes, dry legs and ruffled feathers, drooping wings, thin white feces, and severe cases may die when examining sick birds. The following lesions were found. The liver is dark with spots of hemorrhage in the first days. Then necrosis is as white as a pin. The bile is swollen, intestinal hematoma and hemorrhage. If prolonged, there will be necrosis and ulceration in clusters. The ovaries are atrophied and accumulate blood. Prevention and treatment of diseases. Implement all disease prevention measures for quails, such as make sure the barn is cool and has sunlight. Food must be nutritious and not moldy. Drinking water must be clean and changed regularly. Periodically clean and disinfect the barn with iodine or Dexin Super, the entire floor and walls of the barn when disease occurs. Sick birds need to be isolated for treatment. Limit access to the farm. Clean, collect and destroy manure and bedding. Clean the barn and livestock equipment. Let it dry. Then spray disinfectant. -1, 10 to 15 days apart. Take good care and prevent contact with rodents, cockroaches, and wild birds. Implement the principle of SIM out. Regularly vaccinate against Salmonella bacteria. Supplement vitamin C, a supplement to increase resistance, reduce stress, and create good immunity for raised quails with one of the products such as Vita C 10%, Vita C 20 oral, or Anti-Stress KC. Add additional nutrients to increase the resistance of quail flocks such as Dr.vet oral or VitaHer. All birds in the cage with sick birds should be given Flockle 20 oral or Flockle 30 oral continuously for 3 to 5 days. In addition, Flumsol 200 WS can be used combined with GCKC to supplement quails during treatment. During treatment, farmers should feed birds soft, easy-to-digest foods such as powdered mixture to avoid damage to the digestive mucosa. Above is useful information on measures to prevent and treat common diseases in quails. Wishing you successful breeding. Goodbye and see you again.